Welcome everybody. Thank you for being here. My name is Leila and I will host the conference of tonight. So it's a conference about intersectionality. We here have three speakers who will talk to you about their experience and their own knowledge about intersectionality. And we will also have a testimony in a video. So before starting, I will just ask you maybe to check if your phone are on mute to not disturb when we will speak. And also, I wanted to inform you that we will take some pictures and record the event, so just to be sure that you know about it. So thank you again for being here. And now I will invite our director, Martin Dagneau, to do an introduction about the topic. Thank you.
Et si vous permettez, je vais parler en français. Donc merci beaucoup d'être présent ce soir. Donc je vous souhaite la bienvenue. Comme Leila a dit, on avait un certain nombre d'inscrits, mais il y a des problèmes de parking, donc je pense que les gens vont arriver donc, en cours de conférence. Alors cette conférence se tient dans le cadre de notre campagne Be Inclusive, qui est une campagne que nous menons annuellement, toujours sur les questions d'inclusion, d'intégration des personnes avec un handicap. Cette année, comme Leila l'a dit, nous avons voulu mettre un focus sur la question de l'intersectionnalité, qui est une question qui peut paraître complexe, mais en tout cas qui n'est pas souvent débattue dans l'espace public. Ça nous paraissait donc important de pouvoir l'adresser. Alors, je ne vais pas commencer à expliquer ce qu'est l'intersectionnalité, puisque nous avons ici des experts pour le faire, mais c'est simplement comprendre que quand on fait face à des discriminations, à des problèmes d'accès à l'emploi, à l'éducation, ce n'est pas en regardant par le filtre de chacun des facteurs individuellement que l'on peut comprendre la complexité de la situation que les gens peuvent vivre, mais c'est en observant le croisement de ces différents facteurs. Alors vous savez qu'Handicap International, depuis maintenant 40 ans, je pense, travaille sur le terrain auprès des populations les plus vulnérables. Donc ce constat de cette intersection des différents facteurs, on le voit tous les jours dans notre travail. Ça paraît assez évident. Quand on est une femme en Afrique dans une situation de crise humanitaire, eh bien, c'est un cumul en fait de ces différents éléments qui créent les difficultés pour accéder, en l'occurrence ici, à l'aide humanitaire. Nous avons, alors les a présenté un panel ici d'experts à la fois du terrain, du plaidoyer. Nous avons aussi la chance d'avoir Marois qui va apporter son témoignage sur la manière dont elle vit cette réalité. J'ai eu la chance de pouvoir rencontrer différentes personnalités politiques ces derniers jours avec elle. Et voilà, c'est un témoignage important, poignant et qui j'espère, va illustrer cette problématique. Voilà, j'espère que cette conférence va vous apporter des clés de compréhension, mais aussi un renouvellement peut-être de votre curiosité ou de votre engagement sur cette problématique. Et je vous souhaite une très bonne conférence.
Thank you very much, Martin. So just to start, I will introduce the speakers we have tonight. So first, Marwa Anbawed. So you're a Syrian activist for the right of people with disabilities, and you've been advocating for HI since a bit more than a year. So I will introduce more just after. So we were in the program, maybe you have the name of Lucy Hunt, but she's sick today. So we have Michel Poirier, who is a doctor at University of Luxembourg, a professor at the University of Luxembourg. She will speak about intersectionality. Online on a video, we will have Christine Huyogi, who is a program officer for Handicap International in Kenya. And just on my right, Ariel Goubert, who is Inclusive Development Advocacy Officer for Humanity and Inclusion, or Handicap International, in Belgium, in Brussels. So to start with, we will have the chance to discover the story of Marwa. I will do a short introduction and maybe then ask a few questions to Marwa so we can understand also the connection of her story of her life with the topic of tonight. So Marwa, the war in your home country in Syria altered your life drastically when you were 24 years old. You suffered a car accident when you were in the car with your dad, and then you realized that you were paralyzed from waist down. So after this happened, you had the fear of being unable to evacuate the country of Syria during some time, and then 2 years after the accident, you were able to move to Germany to find like a refuge and to settle in Germany. So the treatment you received from an occupational therapist in Germany, it inspired you to study this field now. So now you are studying occupational therapy. And so your goal is to assist people also who maybe have been through the same as you, so that they can be able to be more comfortable in their daily life. So apart from your studies, you're trying to continue your previous engagement, as you were previously working for associations and helping kids and people when you were back in Syria. So now you're also an advocate for the right of people with disabilities, and you've been advocating for Handicap International for more than a year, and you attended several conferences in Oslo, in New York, in Vienna. And so you raise the importance to protect the rights of people with disabilities, and also like you try to remain to people the importance of the conflict in Syria, which we will maybe talk about it, which stopped, but there are still some open wounds, so still have work to do about it.
I will. It's work, like, yeah. So I want to start to say I feel it's a really good question, because I decided to study that because after the accident, I stayed in Syria 2 years. And these 2 years, it was, I think, the most difficult 2 years in my life, because I didn't learn to do anything alone. It was, I was completely helpless. I always need help, like at least 2 persons, they should be with me, to help me how I can just sit in a good way without the wheelchair, and also in the wheelchair, and also to transfer from the wheelchair to the bed, and even to eat and take shower and change my clothes. We are talking now about just the small details, but it's really so huge things when you completely your life need a help from 2 people. And so when, after 2 years, I arrived to Germany, and there I was in the hospital and in rehabilitation, and then I learned how I can do everything from nothing. There I met a therapist. He's also sitting in a wheelchair, and he also paralyzed, exactly like me. And he just showed me everything, and it's really easy with when you just learn the skills, how you can do it, and the technique. So it was 4 weeks from A to Z, and after that I was like my freedom, I got it again. The things that also in Syria, Now we have 2.5 million people who have disability because of the war. So the need for these things, it's so big. And it was the whole things in my mind. I got the chance to came to Germany and learned how I can do everything alone. But the rest from these people who's in Syria, they didn't. So that was a big things for me, why I want to study these things. And it's also, except this, for a woman, because I feel like if I want to study, if I want to work in Arabic country, or maybe it's not just in Europe, and even that also in Europe, maybe sometimes the woman, we have not always, maybe we can be open to a therapist who's a guy and he will touch us because it's needed. He need to hold your body to teach you how you can transfer or do something alone. So sometimes I feel it's a challenge also for us as a woman, how we can do it with the guys, with this kind of therapist. So that was the big things, why I want to do it. Yeah.
Thank you. My second question was, what was your experience with support and accessibility in Germany compared to your home country, and how did your gender and refugee background affected that?
Yeah, sometimes I feel it's really difficult to compare Syrian with Germany. It's a big, huge, because we are in Syria 14 years from the war. We have nothing. We need to just talk about basic things that people, they have to find food or to survive. This is what we can say it in Syria now. And but in Germany, it's completely different. You can always find ramps and elevator, and even that the government, they will support you. So it's really completely different. And the other way also, what I can say, in both of countries, it was difficult to find a place where I can live, apartment without stairs or with elevator. So what I can say, it's special because I'm coming from the background, from Syria. So people, when I try to find a home in Germany, so they read my last name, and it's clear that I'm not German. And sometimes they don't give me a chance to see this apartment. So it took me exactly, really, I can say, 7 or 6 years to find a home alone, and it's also no stairs, and it's completely fine to for wheelchair user. And I got it because just I got the help from a German person. Without this, I'm sure that till now, maybe I couldn't find that apartment. In other ways, so I can say, I can talk about jobs, how we can find the jobs also because the wheelchair and my disability. We as a Syrian, we got a help from job center when we want to study something. So I went there and I said that I want to study something, and she told me, yeah, now we will help you to study and we will pay for this if you will just find something when you will work in an office. And for me, it was like, why you decide what I should study? It's because your opinion that you put me in a build or in picture that because my wheelchair, I need to study in an office. So after that, I found someone who support me with my studies. So that because of this chance, now I'm studying occupational therapy. So yeah.
So my last question for you is how these 3 factors, being a woman, having a disability, and being a refugee, affected your life in Germany compared to Syria?
This is a good mix also, because I have all these 3 things, like 3 flags, you know. But yeah, it's difficult. Sometimes it's really difficult because people, they will look at you as a weak person, and they will not see what you have also. To comparing this, it's of course, when I was in the Syria, so I couldn't go outside alone. That was also clear the war destroyed everything. Even maybe we can say without the war, do I have a chance to go outside alone in the night? I think no. And it's the same answer what I can say it also in Germany. Sometimes I just waiting for in a station for train, and sometimes come to me guys who's really drunk guys, and they ask me if I need help. It was so clear, 100%, they are not asking me if I need help. It was just for them like easy to attack because they want to have chance to talk more to me. It's also, what can I say, other examples. So as a woman who have this disability and is using wheelchair, I realized that when the guys, when a man who also sitting in wheelchair and have this disability, so he got support directly from his group. As a guy, so, yeah, you can do it. Of course, we will give you this power, and you see that is completely different. But what I realized also, when we are as a woman, have disability, and sitting in the group, it's just women there. Sometimes we be ignored, and sometimes we don't have space to talk, and sometimes we don't have the chance to show ourselves also. So, and I feel these things, it's not about if you have disability or not. I feel it's these things, it's the big things for women, because I feel like we're trying to attack each other, and sometimes we talk about jealous from each other, because I feel we got this from the outside. When we watch movies and shows or something like this, we find comedian movies, it's about two women, they fight because of wedding or because of a guy or because so small things, and they try to put this always in our mind. Also, if you are teenagers, so you learn this, that you, of course, you will be attacked from other women, or you want to attack this woman from nothing. I don't want to talk in that negative way, because without behind me was a beautiful, strong German woman who helped me with everything, who helped me to have a chance to come to Germany, and also till now she helped me and support me with her money from nothing to finish my study. So there is always these two pictures. So, like I said, it's like as a woman, I feel like it's if you have disability or not, it's always a good thing to believe about ourselves as a group, as a woman, and hold our hands to finish what we want. Yeah. And thank you.
Thank you very much, Marwa, for your testimony. So, like, I think it illustrates like very well through all you've been through, and also like your explanation, which are very like powerful, the topic of tonight. And maybe now we will try to understand better the concept of intersectionality. So we have here Michel, who will talk more about intersectionality. So Michel, you are a professor of inclusive education in University of Luxembourg. You are working also with Lucy, who was supposed to be here tonight. And you are part of the Department of Education and Social Work. So you focus your research and teaching on inclusive teacher education. So you were saying that this year a program started to train the teachers in Luxembourg for inclusive education. And you also have some research about international comparative research, inclusive refugee and migration studies. So very wide teams of research. So yeah, maybe we will go through different topics, but mostly trying to understand what is intersectionality about, and like how, what are the challenges that people face through this. So yeah, I can give you this. So you can pass the slide.
Thank you very much for having me. And thank you, Marwa, for your kind and interesting words. I think I can follow up quite well on many things that you said, because I was invited to give you a short introduction into what intersectionality is. And I guess most people who are here already know what it is about. So I will try to be really brief, so don't worry, it will not be a lecture. Professors are really famous for long lectures, don't worry. I'll try to make it short and sweet. And I can really follow up on a lot of things that Marwa already said, so I hope it's okay that many times I will say like, yeah, okay, perfect. So intersectionality, as you can see, is most easily explained as an intersection, like with the street you can see up there. And when you come to an intersection, usually you know what you do, right? There might be a pedestrian way, there might be pedestrian lights, there might be traffic lights, traffic signs, etc. But sometimes it's also a bit complicated because maybe you don't remember, maybe there's some chaos, maybe there's traffic jam, whatever. So on the one hand, it's a quite clear concept. Two streets meet and then we know where to go. We probably have to make a decision, etc. So the intersection per se is a really good example for how things intersect, and sometimes they make a lot of sense and they emphasize something because there's rules. There is kind of something where we can orientate ourselves towards, but then it can also be very complicated because it could be two things that we don't know much about and that kind of irritate us also. The concept was originally introduced by an American researcher, Kimberly Crenshaw, and I guess most of you have already heard about her. But I put a picture there because sometimes I feel like we talk about famous people, but we never know what they look like, so that's what she looks like. The picture was taken in 2018, and I think it's also very important, and that's why I like our panel here. At least I think it's really important. We talk about women a lot, and then usually when we talk about research, it's males. So maybe that's also already a good introduction here. So the definition is actually, intersection means that two aspects, two characteristics, two dimensions of diversity come together, and they intersect, and they open up a perspective on power imbalances in a way. So what we see is, for example, as we heard, you called it the 3 flags that you are waving, right? So at least two things like being female, having a certain age, having a disability, coming from a specific country, or speaking a specific language, for example, could be good examples of an intersection. So it sounds quite easy, right? Two things come together, and either they make sense or they don't make sense, they cause a problem or they don't. Kimberly Crenshaw was among the first people using the concept. Many times in research we have fights who came up with concepts first. In this case it's obvious, it's her. If you read something different, don't believe it, it's her. An example and why it's so important that she came up with this topic was actually that she did some research into the impact gender and cultural or ethnic background or color of skin has. So she looked into an enterprise and she found that depending on where what you look like and what your gender is, you will either be in favor of you will either have kind of good opportunities or you will have bad opportunities. So if you are a white male, you're usually the person who gets the most. If you are a white woman, that's also still okay. But then it gets a bit complicated, right? So being a woman would then have an impact on your situation, and being a black woman in that enterprise, you would be the one who is worse off, or worst off, probably. Another aspect why it's actually really important to talk about intersectionality, not only in research, but also in everyday life and at events as the one we are holding here, is that sometimes if we don't look into the details of intersectionality and two different aspects, it will raise a certain limitation or different views to the complexity of being a human, actually. If we only see one side of the coin, or if we only see one aspect, and if that aspect on top of everything is stereotyped, there might be an issue, right? Because we see someone and we have a specific perception of what a woman is like. We have a specific perception of what a woman in a wheelchair is like. We would go to that person, we would ask a question, we would ask them if they need help, the example that you brought, for example, but probably you're just waiting for a bus or a train, right? And somebody's anticipating, oh, apparently that person needs help, right? So avoiding oversimplification, intersectionality is actually a really, really good concept. And it offers a holistic understanding, because usually humans are really complicated. I don't know if you agree. But there's so many facets to our everyday life and to us being an individual, right? But if we want to know more about the person, we want to understand their background, and we also want to know where people come from, and we also want to understand why certain people are being accepted and why others are not being accepted. And as we already heard, if you wave a couple of those flags, I really like what you said, people might have a lot of stereotypes in their mind, or they might be confused about certain things, or they might have perceptions about what things look like and what kind of help is needed. Because that's another point that is really important. What is really missing, specifically in regards to the intersections that include disability, is that we have a huge gap in research and a huge gap in policies also that refer to disability at first, but that actually also speak to this intersectionality aspect. So usually there's certain people that are not being included in specific discourses. Their life words are not being explored, they are not being heard, they are not being invited, and sometimes it's not possible for them to take part in specific areas of life. So what can happen is that discrimination might be based not only in one aspect, but in two different ones. And usually, as many services are not corresponding, maybe you have some experiences with that too. We have organizations that focus on disability, and we have organizations that focus on disability, right? Others that focus on migration, refugees, etc. Handicap International, I would say, is one of the few that have a different profile. And all these NGOs are doing excellent work, don't get me wrong, but sometimes they just don't have the facilities or the capacity or the knowledge to focus on or refer someone to another service. And then always one of these 2 or 3 aspects will be focused on. So what we really lack is those communication and correspondence between services that are being offered, right? Yeah, and there's also specific challenges to disability, and I could talk for ages about that, but specifically with the different perceptions about disabilities that we have in specific areas or specific countries, actually. Here's just a little example, and don't worry, I won't go into details, but I think it's a really important one, disability and the diagnosis of disability and migration, because it's a really interesting example also for the Luxembourgish context, because we usually talk about issues related to intersectionality and we think they are far away, but I think it's also important to point to the fact that also within actually close by context, we need to discuss those issues. And one aspect is that in many areas of the world, we actually see that there's an overdiagnosis of children or young people coming from other countries and speaking different languages as being disabled. And there's no such thing that in a specific culture or in a specific region there is more types of disabilities or a higher rate of disability. It could be due to environmental factors, it could be due to a number of reasons, but usually the numbers are actually equal or similar to each other. I mean, if there's a high level of, for example, malnutrition, it could be that disability rates are really higher, but it's not a cultural thing, right? So one point that we see is that here, for example, we find that in many countries, the diagnostic procedures are focusing on a specific language. So if children are being tested, they are being tested in one language usually. Luxembourg has a lot of different languages. Luxembourg has a lot of different languages that are being used in tests, but still, and the numbers for Luxembourg are definitely lacking, also in multicultural and multilingual contexts, we see that certain groups are usually overrepresented in the category of disability. So just one example that holds true for the international context. Yeah, so challenges, I already mentioned a lot of these. Lack of data, lack of correspondence has already been discussed. Policy silos, that means that we are usually focusing on a specific group in a policy, and then these policies don't correspond. Same with the services that are offered many times. And what is really a challenge and what is still needed is a lot of awareness raising. So I'm really thankful and happy about events such as these. But there's definitely a lot more needed. And if I may say so, I think especially in times like these, where we see that a lot of DEI, diversity, inclusion, and equity policies are actually being dismantled or stopped in many countries. Yeah, and why is it important to actually include intersectionality in policy, and how could this work, and how could this happen? So a couple of strategies or possible solutions. On the one hand, inclusive policy design, so people with disabilities and other facets should actually be included in policy making and in data collection and analysis, because usually we see that certain groups are not being referred to in research. And this is one of the things that we are doing in our research group, that we do a lot of participatory activities. Education and training has been mentioned before, and also the community engagement. So it's really necessary to include many layers of society when we work on this. And with every little research-related input that we give, we also give you some additional reading if anyone is interested. I'm sure there's also possibility to get in touch if anyone is interested and wants to have further reading. I hope it was not too long. I hope there was maybe some new facets and aspects here, because I guess many of you are familiar with the concept, and I hope I could give at least a little insight into some of the background here. Thank you so much.
Thank you very much, Michelle. So yeah, I hope, as she was saying, that you got a good introduction and maybe now a better understanding of the topic, which is a very complex subject. So now, to illustrate what you've explained, we will have a short video of Christine Huyugi, who is working for HI. She's not working for HI, sorry. She's working for a program which is a partner program from HI in Kenya. So she's working as a program officer for COVO, which is a program which is fighting against the violence, which is a program, sorry, a coalition of violence against women. So this is what is meaning COVO. So in this video, you will have the questions asked by Sophie Pécourt, who is the project manager of Making It Work. Making It Work is a very good example of intersectional program. So it's a program which is aiming to support women with disabilities in specific countries which don't have necessarily access to a lot of infrastructures. So just to say a bit more about Christine before I put the video. So Christine, she's a program officer in charge of COVO. COVO, it's a women's rights organization founded in Kenya in 1995 that advocates for the right of women and girls to be free from all violations in Kenya and beyond. COVO envisions a society where all women and girls enjoy equal rights and freedom and thrive in safe spaces. Christine is a passionate gender equality and social inclusion practitioner and advocate who uses her skills and expertise to support in the design and implementation of programs that center inclusion and feminist approaches. She has over 10 years experience in management of development programs, governance, gender, and advocacy work. So now I will put the recorded video interview of Christine.
Would Would you explain to us Covo's approach to intersectionality and how this has shaped your programming?
Thank you so much, and thank you for having me in this important conversation. COVA has been involved in empowering women in Kenya, work that has seen us develop strong partnership with humanity and inclusion through the Making It Work project. Despite our extensive execution of programs that are aimed at the marginalized women and enhancing their human rights, such as women with disabilities and in particular women with intellectual disabilities, it is our partnership with Making It Work that has helped us interrogate the extent to which we had applied intersectional approaches to our programming. So as part of our partnership, COVA started using the Making It Work how to guide intersectionality in practice. So to bring intersectionality into our work in a more practical and deliberate way. This journey gave us two key perspectives. First, an inward look into ourselves. So we realized that before engaging with the guide, we weren't as intentional about intersectionality as we are now. So it pushed us to reflect on our understanding and our practices. And after that, secondly, we also learned how to embed intersectionality in the way we design and assess our projects. For example, we began asking critical questions about our data. Does it reflect the diversity and complexity of the communities we serve? Are we capturing the experiences of the people at the different intersections, such as gender, disability, ethnicity, or economic status? So let me take the example we implemented during COVID-19 response when we provided cash transfer to women with disabilities in Nairobi's informal settlements. We initially thought this would be a straightforward, but since we had worked with these women before, but we quickly realized that addressing the needs of women with intellectual disability actually required a deeper, more nuanced approach. And this was the turning point for us, actually. So engaging into intersectionality starts with questioning your own diversity, your own biases, and in project design. So we realized that women with different types of disabilities, like physical disability compared to intellectual disability, face different challenges. And staff need to understand these differences and also respond effectively. So we had assumed that simply by targeting women with disabilities, this meant we were being inclusive, but we came to later on learn that women with intellectual disabilities and even their caregivers do engage in business despite often being overlooked by both organizations like ours and other institutions. So this reflection really helped us to see how exclusion can happen even when we think we are being inclusive.
Would you tell us what did an intersectional lens bring to your study of economic exclusion of women in Nairobi's informal settlements?
Thank you so much for that important question. So in 2022, COVA partnered with Making It Work initiative to assess the economic exclusion of women in Nairobi's informal settlements, applying an intersectional lens. So the goal of this was to understand how different aspects of identity like disability, refugee status, ethnicity, religion, or sexual orientation shape women's ability to run sustainable businesses. So this approach allowed us to go beyond general categories and identify the real barriers women face. So we found that while Kenya has social protection programs and funds meant to empower women, these often fail to include those who are most marginalized, like single mothers, with or without disabilities, refugees, or queer women, because policies don't account for multiple identity factors beyond gender, and because women with diverse identity face intersectional discrimination that is often overlooked. So for example, refugee women struggle to access economic support due to lack of documentation. They face harassment and exclusion from both authorities and their own communities. And this is worsened if they have a disability. Women with disabilities not only lack access to training and business opportunities, but they also have to deal with stigma, safety concern, and mobility issues, factors that limit their ability to work during peak hours. Uh, Ethnic favoritism in fund distribution and also cultural biases further exclude women from certain communities. For example, Somali women or women perceived to be from the lesbian, bisexual, and trans community, they're excluded from support systems and opportunity. Similarly, women with disabilities are also not intentionally included in some women-led community support systems, which locally here we call chamas, self-help groups. So through applying an intersectional lens, we're able to uncover these layered forms of discrimination and understand why some women are left behind, even in programs that are meant to include them. This approach is not just about diversity, it's about visibility, equity, and designing solutions that truly reach those that are at the margins and therefore consider effective solutions for intersectional inclusion.
From your perspective, what final message would you like to leave with the audience?
Thank you so much. As my concluding remarks, I would like to draw attention to the fact that conversations on intersectionality are not a preserve of women's rights organizations or NGOs like COVA and HI. Women rights defenders like Sophie, myself, Leila, Susanna, Riel, Mara, or Lucy. So adopting an intersectional lens is a responsibility of all of us. All of you gathered here in Luxembourg this evening. Failure to consider intersectionality might render efforts to promote gender equality and inclusion in general of little impact. At COVAL, we have decided to be intentional, to center the voices and experiences of the most marginalized as they are often excluded from mainstream conversations. We have embraced diversity and intersectionality, and that is why I, Christine, a professional, educated, privileged mother of two in her early 40s, can navigate my different identities to comfortably render services to the communities that COVAL serves. Our commitment to diversity is further reflected in the top leadership as we have Frida, an educated young mother with disability, ably steering the COVAL ship as the executive director. So to conclude, diversity in leadership is one component of intersectional approach that is much needed to ensure we contribute to inclusive societies in Luxembourg, in Kenya, and globally. Thank you.
So it was very important to us to have like a concrete example of intersectionality and to present like what Christine was presenting, like how we do intersectionality in the programs in different countries where women are more threatened and maybe have less opportunities, especially women with disabilities and so on. So I hope you're still awake now to finish this conference. And to finish, we will have Ariel, which is just here, who will present us a fact sheet that she published this year, beginning of 25. And maybe it will also connect with what Christine just said about intersectionality and mostly in some African countries.
Hello everyone, and thank you for having me here, and thank you Marwa and Michel for your interventions. I think intersectionality is a very important concept to understand exclusion, and that humanity and inclusion, especially in the advocacy department, we focus on different thematics, and one of my focus is education. So this year we wanted to publish a fact sheet on the education and especially on the access and like access to education for adolescent girls with disability and how they can stay in education. So this publication is composed of a fact sheet and a short animated video that you will watch later. Why is it important to take into account adolescent girls with disability? As I think that was Marwa who mentioned, and Michelle as well, that some people or organizations only focus on disability, others only on gender. And if you look at many reports, especially in education, you will see there's a lot of focus on either one of the two angles. So the idea here was to actually base this fact sheet on interviews with 117 adolescents, and 85 of them were girls with disabilities and their caregivers. The idea was also to get some point of view of their peers that did not have disability. So that's why in the 170s adolescents, you can see a bit less or girls with disabilities. The idea here was to understand their point of view and their peers and their caregivers' opinions on what is it like to be in school and what makes them stay in school and what makes them drop out of school. Because you will see they actually face different struggles in comparison to girls without disabilities or boys with disabilities. So this fact sheet sheds the light on the struggles and levels for adolescent girls with disabilities to stay and progress in education. The interviews were made in Nepal, Rwanda, and Senegal. So we have a large view on different types of countries. And it was realized with the financial support of the Luxembourg Ministry of Foreign and European Affairs. So let's start from the beginning. What's the global education context, and where do we stand today? If you look at the global and national frameworks, there is frameworks on quality and inclusive education and gender equality, but there is still a significant gap that remains between the commitments and the realities faced by girls with disabilities. Globally, children and youth with disabilities are significantly overrepresented among those out of school, and disparities worsen in adolescence. That's why we wanted to focus on this specifically, and not just on girls with disabilities, but on adolescent girls with disabilities, because that's a period of transition in life and education when the risk of dropping out increases significantly. And for adolescent girls with disabilities, the risk of dropping out is even greater due to the intersection of age, gender, and disability. Indeed, they face unique additional barriers in comparison to other people without disabilities or boys with disabilities. For example, gender-based violence, early and forced marriage, imposed domestic responsibilities, or inadequate hygiene facilities. And that makes them even more vulnerable to drop out of school. If you look at some statistics, I just think those ones are very relevant. They're not super recent, but I think they still apply. Adolescents, boys or girls, are twice as likely to be out of school as younger children. So that shows that adolescence is really a critical period when there is a chance to drop out of school more than just accessing school when you a young person. And only almost 42% of girls with disabilities have completed primary school, compared with 50% of boys with disabilities and almost 53% of girls without disability. From this fact sheet, I just wanted to highlight a few quotes that I think were very impacting, and that shows like a few things. For example, families and communities exclude girls with disabilities, and that's sometimes due to myth and biases. So you can see this mother in Nepal who said that whenever her daughter leaves the neighbor's place, they clean where she sat, and she thinks it's humiliating. There's also an internalization of societal prejudice that leads girls to feel hopeless. This 12-year-old girl in Nepal talking about her blind friends and saying that that one wanted to end her life because she felt useless. We've noticed as well that parents often struggle between protecting their daughters with disabilities and also limiting their opportunities, because some sacrifice a lot to send them to school, and at the same time they are very afraid of what might be happening outside. So sometimes they also prevent them from going to school because of this. And girls with disabilities, of course, face a higher risk of violence and abuse, both in schools and within their communities. So in this fact sheet, you will have access to it outside. You will see some flyers with a QR code, so you can access it straight away if you want to dive a bit deeper into this. But just to give you an overview, what we found, and this is not an exhaustive report, but just a fact sheet based on interviews with adolescent girls with disabilities and their caregivers. The main barriers to education for adolescent girls with disabilities we found were basically four aspects. The first one is, you've seen it earlier, the socio and cultural norms. So this has to do with a stigma around disability, but also gender, because girls with disabilities in some communities are seen as less valuable. And they perceive themselves like this for most of them. So there are also a lot of harmful norms leading to gender-based violence, early marriage, and an unequal burden of domestic responsibilities. We've noticed, of course, some economic factors that, like, families often prioritize the education of sons over daughters with disabilities when they do not have a lot of resources. And of course, like for any, that being boys with disability or girls with disabilities, there's always a high cost of assistive devices and specialized materials to send them to school. In terms of educational settings, there is a lack of accessibility, whether it be in the classrooms, playgrounds, other facilities. There is an inadequate teacher training and support, and gender-separated toilets and menstrual care support are often absent, and those are not very important for adolescent girls with disabilities. When it comes to safety and violence, girls with disabilities, I said it earlier, are more vulnerable to violence. And we've noticed a lack of a safeguarding mechanism in schools. So building systems that works for all require everyone to act. We cannot rely on individual resilience to fix systemic exclusion. So whether it be government, donors, and civil society, everyone must act together. You'll find a few recommendations in the fact sheet if you want to read it. Again, I'll go a bit quick on this. So it's important to challenge harmful beliefs that exclude girls with disabilities from education. That could be, for example, running or supporting campaign against stigma and discrimination. That could also be improve educational curricula and teacher training to address diversity and inclusion. It's important to make educational settings more accessible and more inclusive, to ensure accessible facilities and material, to invest in teachers' training and support, and to improve access to assistive devices and menstrual products. Also, it's important to ensuring protection and safety of girls with disabilities and put in place safeguarding policies with accessible reporting mechanisms. And also supporting and empowering families and communities of children with disabilities, especially single mothers, by reducing the cost of education for the most vulnerable households, to develop or support livelihood programs for parents, and also to ensure access to psychosocial support for caregivers. So I'd like you to keep in mind those 3 things, if there are 3 things you need to remember from this presentation. It's that no girl should be left behind with disability or not, because education is a fundamental right, and that includes girls with disabilities. And education, we know it has a transformative effect on individuals, but also on their communities. Also, barriers are interconnected, so must be the solution. As Michelle was explaining, solutions are also interconnected. They need to be, ensuring that adolescent girls with disabilities continue their education requires addressing stigma, economic barriers, accessibility, and violence through a comprehensive and intersectional approach. And all stakeholders must act. Government, international donors, school authorities, and civil society organizations have a role to play in this. To finish, I'd like to show you the video that accompanies this fact sheet. So it's a 2 minutes video, so I'm going to let you with this if my colleague can play it. I can play it? Okay. How does that work?
Adolescence is a time of growth and opportunity. But for many, it's also a time when the risk of dropping out of school is the highest, especially in low and middle income countries. For adolescent girls with disabilities, the risk is even greater because of the overlapping discrimination based on age, gender, and disability. Why is this happening? Different factors concur. Stigma. Stigma and prejudice often isolate them, reduce their self-confidence and their motivation to stay in school. Gender and social norms. Gender and social norms result in household responsibilities and child-enforced marriage that are key factors limiting educational opportunities. Financial limitations. Financial limitations lead families to prioritize the education of children without disabilities, especially boys. Gender-based violence. Parents favor their daughter's safety, especially from gender-based violence, and hesitate to send them to school. Even when girls with disabilities manage to attend school, they often face a lack of accessibility, inadequate support, and negative attitudes. These are only additional manifestations of their exclusion. But we can change this. To ensure that girls with disabilities have equal access to education, we need to focus on changing harmful beliefs on disability and gender, creating accessible and inclusive educational settings, ensuring protection and safety, supporting and empowering families and communities. Together, we can build a future where no girl is left behind.
And that's it. Thanks for your time. And again, there's a flyer outside if you want to check the fact sheet. It's very small. And again, it's based on interviews from girls who are living this. So that was the idea of the fact sheet. Thank you all.
So thank you very much, Ariel. I think it was a very good summary of all that we've talked about tonight. So thank you to the 3 of you for your inspirational and strong testimonies. I think that we've learned a lot. So now we have some time. If you have some questions to ask, Naomi will give you the mic. So feel brave, and yeah, we are here to answer your questions.
Thank you. Thank you very much for this presentation. I have a question for Professor Poirier. Did you observe some progresses in terms of policies addressing this intersectionality here in Luxembourg and maybe more widely in Europe? And maybe a second part of the question, maybe for Nawal and Ariel. In these examples that you will give us, do you think that there are some good practices that can be adapted in the challenging countries?
Thank you for the question. It's a really tricky one, I have to say. I'm still a bit hesitant to talk about the Luxembourgish context in detail because I'm probably not here long enough. So I'll probably meander myself to the international one because then I can probably navigate your question a bit better. I think it's rather twofold because when we see inclusion, for example, we still see that there's a lot of siloed policies because we need them in a way, right? Because if we just saw what we just saw in the video is quite interesting because as long as no inclusive system is in place, and that's the case in many contexts, although a lot of people are doing fantastic work already, right? So what I feel is that at a certain level in current times, what we need is those focused policies because we need the perspective on those groups because we don't have it so far. So we need to understand those specific areas, right? But I think when it comes, for example, to the United Nations Convention on the Rights of Persons with Disabilities, I think what would be fantastic in that example is to link those conventions much further, for example, because those international policies that come on a global level, they still have a lot of impact in a lot of communities, because they provide a basis to have, political agenda, to have political activism, and they also infuse, for example, funding schemes, right? I mean, if you look at the case of the US at the moment, if I would take my research that I've been doing in the last 15 years and now take the list that has been published on which words are no longer supposed to be in research, I definitely could, throw everything out. And it's not to point to that one country and say everything's going down the drain, but I think, it's quite interesting to see that we also have kind of imbalanced policies at the moment, right? And those gaps are getting bigger again, I feel. So it's really a mixed bag, but it's a really good question. Thank you. It was not a good answer, I know, but I tried.
If you can just please repeat the question to let me understand exactly what you mean.
The question was about the examples, the good examples, good practices here in Europe that might be adapted in challenging countries.
You mean with inclusion?
In
right?
terms of policies, yes.
So I feel like with the good things in Europe that the last 5 years, it's more people talk about inclusion and they're trying to have the education for everyone, even in the school and even in university. This is what I feel. Now when I go to workshops on where I go from my school to work with the patients and something like this. So I feel it's not that difficult sometimes to talk about inclusion. Even that sometimes it's difficult, to be honest. But sometimes also on the other hand, I feel like people trying to understand. But if you will go to place and you will, I don't want to name a country now, and so it was really nice there because they try to build ramps also when there is like steps or stairs like this. And in this ramps, I need a person who helped me to got this ramp. So, but I feel like it's still like it's a good way. Ramps, but need help. At least there is ramp. This is what I feel sometimes. And I hope that in a few years it will be completely different because I feel we start and we have this power for this. Yeah.
Yeah, I agree with this. I think, and the main thing for me is stigma. I think it's at the root of a lot of things. So if you try to change harmful belief, and of course it's nothing perfect in Europe, but some changes have been made toward us, and you can see like it's easier to talk about inclusion, because as long as people have belief on someone, whether it be because the person has disability or the person is homosexual or whatever, like, or the person has this or that religion, this is the root of exclusion. So I think this is the first thing we can all start with at individual level and just challenge this, really.
Let me say something also. I feel like we should not accept that people that will understand what mean inclusion if you will not work about it. How much you will work, how much you will let the people understand what mean. So it will be not like be afraid question. Do you know what mean inclusion? It's like, oh, what mean? Do you know that if I use wheelchair, so I'm not available to go to every restaurant or to every place? It's like, oh, really? I didn't think about it. So you know what I mean? So how much we will work, how much we will find what we worked about it. Yeah.
Any other question, maybe? Okay, so, well, thank you for, I mean, we will have more time outside too, if you have some personal question also, if you want to ask to the speakers. So thank you to the three of you to be here, and for the testimonial also of Christine. So I think we are coming back home tonight with a lot of knowledge and maybe some reflections about inclusion and what does really mean inclusion. So just so you know, here in Luxembourg, we organize a lot of awareness events, such as this one. So it can be either like for the public, but also it's some workshops in schools or in companies. It's mostly about inclusion, about disability, but can be even wider, depending on what are you interested in. And also maybe you saw the campaign that we are doing right now about intersectionality. So the event is taking place in the part of this campaign about intersectionality. So you will maybe see the posters outside. So thank you very much for being here.